Is there an ideal training split? Should you be focusing on high reps versus low reps for fat loss or muscle gain? We'll be diving into this topic in today's episode. All right, homies, welcome back. Today is going to be a training focus, as we obviously just alluded to. And we're going to dive right in. So, do you guys have a favorite training split? Is there something you lean towards?
Personally or
typically?
professionally?
Let's go professional first.
What
in
if
the
my
ideal
professional
scenario.
and my personal are the same?
Then you just set yourself
What
up.
a nerd.
Well, I will preface this. I think that my stance on this has changed a lot over the years, and probably similarly for you guys as well. I think
Where'd
when
you start and where are you now?
Yeah, I think when I first started, I was very like team, the grind never stops, team hashtag no rest days, team train for 2 hours a day minimum, or your workout didn't count, like blah, blah, blah. And I think for a long time I was like, for clients, I was like, yeah, 5-6 days a week is great. And the older I've gotten and the more people that I've worked with, the more I realize that a lot of people don't want to train at that frequency. Not everyone loves training. Like, some people are really out here just like exercising to take care of themselves because they know they should and they know like it's good for them. Not everyone is super passionate about lifting or exercise. Some people really don't like exercise or lifting or how it makes them feel. So I am always team, and I know all three of us are always team, what works best for your schedule and what can you recover from. Those are going to be your two biggest factors and key elements in determining training frequency. I used to be like a 6-7 day a week gal. Now I'm a 4 day a week lifting gal, and then typically another 1 or 2 cardio days with that. But I would say that for most clients that I see, 3 to 4 days a week is the sweet spot for a lot of our clients. I would say the vast majority of our clients are between 3 and 4 days a week, and do really, really well with that frequency because it fits their schedule much, much better. It's easier to recover from. It's not so much that you're like dreading the volume or dreading the workouts. So it's what I follow, yes, but professionally, it's what I see people have the most consistency with.
It's probably also like growing up, you went to maybe not you, Joel, you weren't a big drinker, but you went to the gym and you went to the bar. Like, those were the hangout spots. So like you had extra motivation to be in the gym basically every single day. Like that one day off that we all took sometimes was like forced. Like, I still want to go, but I know I probably should not, train all 7 days, just take one rest day. So part of that was the social aspect. I think growing up, as time becomes more finite and like you have less and less and less and responsibilities keep growing, I don't know if everyone loses the joy of training every day and like that connection, but it's definitely a piece. I think there's more to it than just scaling back as you get older. I think, yes, lifestyle changes, but there was also this additional draw to being there all the time.
I would argue that a lot of people still have that. We just don't have that anymore, Josh,
Fair.
because we don't
don't
go
go
to
to
a
the
public gym. But when we
think
visited Joelle, I really enjoyed like that social, like that was like we came back from visiting her and I was like, man, I wish we had a gym like that near us, because I would go to the gym because it got me out of the house and I got to
Who are you
see,
talking to? What do you mean social?
got to see other people besides you all day. So it was like, you still got that even if you weren't really talking to anybody, you're just around other human beings. And I think that is a big draw for a lot of people at our age still, because that's where they socialize and see people outside of probably work or their job. So I think it depends on the person, of course, but I'm very much in the same boat, Joelle. Like when I was like, I think about powerlifting days, like my whole life revolved around like eat, sleep, breathe, powerlifting. Like it was just my thing. It was what got me up and excited for the day. And
you also got to do it at this beautiful outdoor gym in San Diego.
Yeah, I mean, life was just different. Like when we had free time, we would spend it at the gym for hours and just not be rushed and I can't imagine what that's like now. But I feel like like in your 20s, you just have endless amounts of freedom and time where it's like you need to fill that void. So I was never of the camp where I trained every day. I don't think I trained 7 days per week ever, but I definitely was I'm there for good 2.5 hours person. So I would say I went from maybe 5 to 6 days per week, and now it's typically 4 days per week. Sometimes I'll get a fifth bonus day in there depending on the season, but 4 is my personal sweet spot for strength. And then if I'm in a season of running also, where like right before I got pregnant when I was running and lifting, it was 5 days per week of sometimes a 2 a day. So I would run in the morning and lift in the afternoon, just depending on what that looked like. So it depends on my goals, but most of the time it's 4 days per week.
I am very, like, obviously I can't do this, but I am looking back curious if I've always responded best to 5 or 6 days, or if that's like just what I did and I happen to be responding well back in the day. Because I would go through periods where I would scale it back like very briefly to like 4 days. And this was kind of the power building phase of my life when I was powerlifting, but with the additional accessory work for the volume and focusing on getting stronger and bigger. And I always saw my best physique improvements and my best strength improvements when I was at 4 days per week, with that extra, the rest in between, obviously, as opposed to going 6 days a week and probably significantly higher volume overall. So I do wonder if I would have gotten even further had I just stuck to 4 days throughout, because now, just based on time and everything going on, I'm at 3 to 4 days a week. I am balancing in additional cardio, but I'm also responding really, really well. When I made this shift a year ago to Evolve Hybrid, when I started programming that about 6 months ago, I've been doing it for about a year. I'm like, yes, I'm drawn to the gym. Am I liking it less? I've got less time to do it, but I'm seeing much better results. Like it was a mental conundrum for me to scale it back. And obviously we preach it. Like if you're recovering better, you're going to perform better. You're going to improve more overall. It's hard to get yourself to do that. Like I know, self to self perspective versus self to client perspective. But I am very curious how everything would have looked, what percentage improvement I would have seen had I just stuck with 4 days throughout.
I think it so depends on just where you are in your health and fitness journey. Like I very much view the fact that we train 3-4 days a week plus cardio. I very much view that, to be quite frank, as like maturing throughout our health and fitness journey. Yes, part of it is like we have kids, our recovery capacity is a little different, like our schedules are really chaotic, so we try to get more effective and efficient within our workouts. But I think there's also a part of it that like we don't feel as called to spend 7 days in the gym or to spend 2 hours on a workout. I don't know. That's how I feel. I feel like a big part of it for me was understanding, like being able to separate what I should logically do versus what I want to emotionally do. Because for a long time, it was like emotionally, I want to be in the gym 7 days a week for 2 hours a day. And there was no like dragging ass to get there. Like you had to drag me out of the gym because I wanted to be there so much. And I still love the gym and love exercise, but I don't have that same desire in the same way. And granted, I also think at the time when I was training that way and that frequently and for that long and such, I think I just had a much different relationship with exercise and food and body image. Like it was like I had to be burning X amount of calories on my Apple Watch during that workout. And so sometimes it took me 2 hours to hit that amount on my watch. Like it was just a way different relationship with exercise.
I think something you said the word mature, Joelle, like we've all matured in the gym. And that reminded me, or kind of made me think about, and this is something I think that's important to touch on too. Like we all have trained at those higher intensities, at those higher volume levels for years. And I think personally, that in a way has made it easier to transition to 3 or 4 days per week because we have the muscle built. We've gone through fat loss phases. We kind of have achieved that physique, that goal physique, if you will. And it's definitely important to acknowledge that it's easier to maintain an amount of muscle mass, a certain physique, than it is to like a newbie starting from going point A to point B. So I don't know. I think that's just important to touch on because there's also a lot of people on social media who will spew things like, oh, you only need to train 2 to 3 days per week and you can look like this. And sure, you might see great progress. However, if you do want to achieve that higher amount of muscle mass or, get to that next 5% or whatever it is, there is going to be a certain period of time where you might need to do more. So it is definitely individual. Don't take that as like I need to go train 6 or 7 days per week. I'm not saying that either, but I think I just want to remind you guys listening that it is easier to maintain a certain type of physique than it is to get there initially, in a sense.
I think
you also said something that kind of triggered a mini side angle to this as far as like fulfillment. So like, yes, we have all these other things going on, and for a while, and a lot of us still utilize the gym as that fulfillment. It's this striving for the ideal physique, optimal health, overall health and wellness. But now, like, we do have these other areas. We have parenthood. We've got these projects we're working on for the businesses. And it's like, rather than the gym is 80% of the time now, it becomes a fraction of that. Like, whether it's a third, if you want to go that just blunt with it. But the kids, huge fulfillment. These projects, we want to put so much time into those as well for work. And then the gym kind of gets what's left over from that point. So the way you put it, and then kind of self-reflecting there, I think that's another reason that, I personally, and I know a lot of listeners probably feel the same way, or if they've gone through those transitions, or if they haven't yet, and it's like, I still feel addicted to the gym. Do you have things that are fulfilling outside of that? Do you have things that you're finding meaning in your life in these different avenues? And if you have a really hard time scaling back from those 6-7 days a week, what do you have going on outside of that? What can you do? What can you work on?
I want to come back to one other thing too that Alessandra mentioned. I love that we're all just bouncing off of everything everyone else is saying right now, but it's relevant and I think it's helpful. But Alessandra, you talked about how it can be easier to maintain your muscle and strength and so on when dropping frequency or dropping intensity a little bit because there's this foundation that's already been built. But the other thing that I want to highlight with that too is that it's the same for habits. And so to Alessandra's point, you can't look at someone's chapter 20 when you're at chapter 1 and be like, I just want to be there. Why do they get to look like that? Like, we've been in this for a long time. And not only can we change the way we train and still like maintain a specific physique or something like that, we have also been maintaining habits, some variation of the habits that are just ingrained in us at this point. Like, we all train differently than we did 10 years ago, but we have the same foundational habits. We're still shooting for protein at every meal. We're still prioritizing fiber and color. We're still prioritizing sleep. We're still prioritizing rest. We are training intensely when we are training. Like, there are foundations that no matter what our training split looks like, no matter if we're training in a gym or training at home, or what the frequency is, or what the intensity is, or if we're doing physique versus build versus hybrid, we all still have those same baseline habits or foundations that allow us to continue seeing the progress we want to see or maintaining the results that we want to see, because it's not just the training. Like, there are other pieces that are, quote, easier for us because we are used to maintaining those other foundational components.
I would even argue that piece, that habit functionality, is more important than the training side of things. Because think about when things get nuts, when we get sick, when everything's hitting the fan, just amongst our group here, we don't have this cycle of gaining a ton of weight. Like, let's say we're 2 or 3 months out of our routine. We don't gain 15 pounds. Right. If anything, like in this week, we consider this detrimental, but we lose more weight. Like, we lose a lot of that quote unquote progress that we saw, the muscle, the physique, the tone, whatever. Because those habits are in place, because we are able to maintain the core functionality of our lives at an optimal, close to optimal level in regards to taking care of ourselves and all those other areas. So for those who are on this constant roller coaster, up and down, gaining weight, losing weight, it's like training is absolutely one component of that. But until you have that habit foundation down, you're not going to hit this point of consistent progress, because progress is linear. So if we can avoid the free fall back to where we started and create this graph that's like, okay, progress, plateau, maintain this when things get crazy, and then we're going to build from here. Progress, 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 maintain. Then we start climbing the mountain, and we find new mountains to climb versus going up and down the same hill over and over and over and over again.
Yeah, I think a great example of this exactly is, obviously I just went through another pregnancy, 2 pregnancies in the last 18 months.
Sorry about that.
Or whatever. Thanks. But we're not going to get into that on this one. No, but I posted just a quick little selfie the other day of like how my quads have really maintained, like my quads did not really shrink at all this pregnancy, and I'm super proud of it. It's one of my biggest aesthetic wins, on top of just, feeling really good this postpartum physically
you and
and
all
like
of our kids.
functionally. All of our kids have my quads, so you're welcome.
So funny.
Yeah, that's true.
But yeah, I did train heavy this pregnancy, and I did really maintain that consistency, but my lifting intensity was still a lot less than it would have been if I wasn't pregnant. I still was not, I was not running after 21 weeks. So like a lot of my training did change per se for me. However, there was not one day where I ate less than 100 grams of protein. And I mean, probably in the last 5 years, like I always get at least 100 grams of protein in. I always hit at least, at the very minimum, 20 grams of fiber. And that's on a terrible eating day. So just to put that in perspective, like your habits do matter so much. And yes, my training was pretty good, but it was nowhere near what the level it would have been if I wasn't pregnant. And I was able to maintain a lot of muscle mass because of that. So just to kind of give you a full big picture here of like, yeah, pregnancy can just, I mean, obviously I had an easy quote unquote pregnancy compared to like Joelle, who's throwing up every day for how many months?
About 20 weeks both times.
20 weeks, which makes it harder. But because I was able to maintain those habits, I think that played a big role in how I feel and how my quads look. Specifically right now.
How Wes's quads look, how Wes's delt cap looks, how his biceps look.
Wes is gonna be built like a brick shit house.
Real quick, again, a mini side tangent, but it's still related because of everything you just said. When it comes to doing all these things throughout pregnancy, I know we talked about this in another episode, but just briefly what that's doing to set up the kid for success. Like you talked about obese parents being more likely, or the child be more susceptible to obesity. So kind of taking the reins a bit in pregnancy, if you want to just do a quick 90-second summary on that guy.
I mean, when you think about it, it's such a simple concept, right? And for some reason, people do not view it that way. Most people do not view it that way. But while you're pregnant, if you take care of your health, take care of your body, that has a direct impact on your baby. From their metabolic health, their brain development. Joelle, I know you just did a whole presentation on this, I think, or part of it was about how this can impact, what was it? Just, I don't want to misquote what you presented on.
Yeah, this was like exercise across the women's life cycle.
Lifespan.
Yeah, so we did touch on pre and postnatal, and I think you said it well. I think the simplest way to put it is that any benefit that mom is getting from exercise, baby is getting in some capacity. So you think about mom benefiting from exercise metabolically, great, baby is benefiting as well. Mom is benefiting cardiovascularly, great, baby is benefiting cardiovascularly as well. And so it's not just that it's healthy for mom to exercise, it's healthy for mom to exercise or pregnant mom to exercise because yes, it's going to improve pregnancy outcomes and like labor and delivery outcomes. Like we see lower risk of gestational diabetes, lower risk of preeclampsia, lower risk of hypertension, obviously lessen weight gain. But a lot of times we don't think about like, how is it affecting the baby? Or when people do think about how it's affecting the baby, they're like, oh, it's negatively affecting the baby, or you're, going to put the baby in a bad position, or you're going to, risk miscarriage. And there's nothing that shows that. In fact, it shows the opposite. It shows that you're less likely to miscarry, less likely to go into preterm labor, less likely to have a C-section if you do exercise. So yeah, I would say that's the most simple way that we could put it.
It's funny too, because the post that kind of blew up that I talked about this with, there were a lot of comments, and this is the internet for you. There were a lot of comments that were like, well, I didn't exercise while pregnant and my kid is just fine. Or, well, I'm pregnant and I'm not exercising. Does that mean my baby is doomed? And that's not the point that I was trying to make. Like, it's just, the point I was trying to make was the more that you can do, the better you're going to benefit yourself and your baby. And that doesn't mean that if you're not exercising, your baby's going to automatically be obese and, you know, have all of these health issues. Like, that's not, well, also not true. But just an example of how black and white people on the internet think, or where if it's not, oh, I'm not doing all of these things, I'm not going. What are you laughing at?
People are going to take that clip and run with it. So can we just rewind for a second? You're not talking about black and white people. You're talking about black and white scenarios.
No, black and white thinking.
The way that you said it was black and white people.
No, it wasn't. Joelle,
no,
did I say it that way?
I didn't hear it like that, but as soon as Josh started laughing, I knew that's where it was about to go.
Oh my God.
So
to clarify, I'm not talking about
something like it's not black and white people, like comma people.
Oh,
but Josh just
do I have to
like
say
black and white
comma?
people.
I'm just so it doesn't get clipped and you don't get called racist or whatever the situation. Black and white, comma, people.
What a world we live in.
All or nothing thinking. How about that? Can we switch it to that?
That's much better, for sure.
That's where, I mean, give me some, I still have pregnancy brain recovering going on here.
Now you have newborn
We're talking about lunatics on the internet taking shit and running with it. I know what you meant. We're just going to clarify for the people.
Anyway, that's just, I mean, that's the internet.
No matter
what you post, someone will.
Well, yeah. I was going to say, no matter your race, age, ethnicity, culture, you can benefit from exercise, and your baby can benefit from exercise.
Exactly. That's all I was trying to say. But it was also kind of mind blowing how people were in the comments arguing that, like, oh, can you give us this data? Like, where are you pulling this from? Like
literally,
how is it not common sense? Yeah. Like, treat your body well and your baby will have better health outcomes because you're treating your body well. Like,
it also shows me that my guess is there's also a lot of medical professionals behind on this, because the ACOG, which is the American College of Obstetricians and Gynecologists, they are essentially the governing body of OBGYNs and pregnancy, and they base their guidelines off of current research. So if the ACOG is saying resistance training is not only safe but beneficial to start or continue during pregnancy, that healthy for mom and baby, like, I think it's the ACOG guidelines, strength training at least twice a week, pelvic floor and breathing techniques, diaphragmatic breathing, cardiovascular exercise. The recommendation from ACOG is 20 to 30 minutes of moderate intensity exercise on most or all days of the week. And so here, governing body of pregnancy research is saying, we want you doing cardio 20 to 30 minutes a day. And we have, then this could be a whole other side tangent of, like, people are afraid to exercise too much, and they're like afraid to do exercise on back-to-back days, because now we're in this weird culture of, like, you're going to overtrain and whatever. That's a whole thing for another time.
To your exact point, Joelle, yes, we've got this governing body that's saying all the right things, but from this position of authority, a la their specific healthcare provider, who's telling them not to lift heavy, to not do these things. So they're not staying up to date on these guidelines.
That's where she was going with it.
Okay.
Exactly. Yeah, that's where I was going with it. Like, my first pregnancy, Alessandra, you probably know this, but my first pregnancy, I was seeing an OB, and it was like it was maybe like my second appointment, and we sat down, I just had some more questions, and I told him, I was exercising, and he said, all right, well, a little light exercise is fine. And I said, well, what do you consider light exercise? He's like, if you want to, like, do some light work on the elliptical, like, that would be okay. And I said, well, I'm strength training. I'm on a Stairmaster. I'm biking. I'm, squatting. I'm strength training, I said. And he clarified with, I didn't say squatting. He clarified with, well, as long as you're not squatting or anything like that. And I was like, what's wrong with squatting? Like, is there something in, and I asked him this, like, is
genuinely asking,
is there something in that you've seen on my ultrasound or in my medical work or in my labs that you're telling me that exercise is contraindicated for me? Am I a high risk pregnancy that I didn't know about? And if I am, we need to have that conversation before we talk about exercise. And he said his response to that was, well, as long as you're not squatting or like doing squats or anything like that. And I said, what's wrong with squats? And his response was, are you going to be one of my difficult patients? And I fired him. And that was the last time I saw him.
Because don't ever say that to Joelle.
If I am more up to speed as a patient than you are on exercise guidelines for pregnant women, you're not going to be my doctor. Absolutely not. There is no reason that as a patient, I should know more than that. And I understand, like, I have a degree in exercise science and so on, but I'm citing your guidelines as an OB. I'm citing ACOG guidelines. Why am I more up to speed on ACOG guidelines than you? Fired. Goodbye.
Yeah.
Found the midwife.
It's unfortunate because you're not a rare occurrence there still to this day. That's what many women are told, or don't lift over 25 pounds. What happens when you have a 30-pound toddler or 30-pound kid? They ask you to lift them.
A kid
you
in
can't
a car
lift
seat.
them.
Yeah, your kid in a car seat in one hand and groceries in the other hand, or pushing a stroller with another hand, or baby wearing your 25-pound kid. Like,
yeah, there's nothing in the current standings of ACOG where it says there's a max weight that you should lift, a max heart rate. Like, all of that has been squashed because we just don't have anything to support that. That's what you should do. But here's the thing, and here's what I want you to take away from this. Because if you do read the guidelines, like, yeah, it talks about moderate intensity, and I'll get questions like, well, what about high intensity? Or like, I'm a CrossFitter, and does that mean I have to stop doing CrossFit while I'm pregnant? Here's what I want you to remember if you are pregnant listening to this. Training is individual. Your level of training is individual. Your training age, your fitness level, all of that impacts what you really can continue while pregnant. And previously, and this is another argument people have left a million times in my comments, well, if you weren't exercising before pregnancy, you shouldn't start while you're pregnant. Nope, that is also no longer recommended. That is outdated information. So if you have done nothing beforehand and you want to start, you are cleared to start. Maybe don't walk into the gym and squat 200 pounds. Like, intensity and your level of intensity depends on what you were doing before. And that's with a pregnant person or not. If someone came to train with us and, you know, they're a high level athlete, we're going to program for them as such. We're going to factor in your training fitness level. So it is such a spectrum as far as what is, and I don't even like using the word safe because it's, we know exercise is safe, but what is appropriate for this phase of life for you. And it really just comes down to making a training program that you're comfortable with mentally, that you feel good about, and that physically makes sense for what your body is used to doing.
All right, let's come back for...
If you have no clue how to do that on your own, hire a Levolution pre- and postnatal.
Hello, we can help you.
There you go. All right, bringing it back for the non-pregos for right now, for the remainder of this episode.
Yeah, sorry. We ranted there for a minute.
That was a long 90 seconds.
That's what gets
we get heated when it comes to pregnancy and exercise and misinformation. But yes, we will bring it back to the non-pregnancy exercise information.
All right, so here's what we're going to do. I want to break down general volume guidelines. Let's just lay those out there because that's going to fall into the next category, which we're going to blast through before we go through specific training techniques. So the next one, just to give you the forewarning, it's not the right word. Anyway, the next one we're going to go through, the preface. We'll go through different types of training splits. We're going to break down how many days per week of training and then ideal splits for those. But just so you know what to compile within those categories. General volume guidelines. We can give the range. You could talk about intensities real quick, but just so they know, all right, I'm breaking down X amount of sets for each body part over the course of, 2 through 6 days per week. What do you guys prefer? What is at this moment in time, what would you give for the general range of optimal sets per body part per week? Is it still 10 to 20?
I think so. I mean, I personally, I don't really go by number of sets. if I'm being honest. Like, I mean, that's not how I structure my own training.
I was just gonna say I don't go by body part either. Like
I
that's not
more
how I
so
train.
Explain.
I would say I more so shoot for an exercise range, like 4 to 6 exercises per session, 5 to 6 exercises per session. Again, that's going to depend on the split. So if someone is training more frequently versus less frequently, you might divvy up the volume a little bit differently. If someone's training 3 days a week, you might add more exercises or more volume to those 3 days a week because you're trying to do more in less time. If you are training 5, 6 days a week, you can consolidate that a little bit more so that workouts aren't as long or you're not doing as many exercises because you have more sessions to spread it across. So for me, typically in my own programming, or if you're in Muscle Mommy and you know that programming, we're typically 5 to 6 exercises. I'm a big 3-set gal. I don't love 4 sets per lift. Depends on the lift, but most of the time I don't program 4 sets per lift.
For time purposes, or what is your reasoning?
Or
Or hitting optimal intensity rather.
So both. I would rather someone squeeze in an extra exercise and get more variety in their exercise selection and hitting a muscle differently with a new exercise than having a 4th set on everything and losing that variety. And then also from a fatigue standpoint, like if we can't do what we need to do in 3 sets and get the intensity that we want in 3 sets, then I think that 4th is I just think it's unnecessary in most cases.
Yeah. I think this is a good example too, Josh, of how you program, like physique, for example, is very body part or muscle group rather based compared to build and move, which I program and how I structure that is really more so like we have our warm up mobility chunk of that's like 4 minutes in the beginning. I pick 2 to 3 compound lifts for that day, usually 2. And then I have a few accessory movements to support. So build is an upper lower split with the 5th day being kind of like a fun day, whatever I'm feeling for that month. So we finish with a couple accessories to support whether it's upper or lower. Oh, sorry, I skipped our plyo movement. So warm up mobility, 1 to 2 plyo movements to work on that explosive power. Compound movements, usually 2 to 3, and then a couple accessory movements to finish up. And oftentimes that does include a specific core movement too. But that's kind of how I structure it. And then for the compound lifts, we're typically more strength based. There are months where we do higher reps, but that's typically our 5 to 8 rep range. But yeah, that's kind of how I set that up versus like thinking about, okay, this body part has this many sets per week.
Okay.
Yeah, I would say with a bodybuilding split, that's a little bit more body part focused. You're probably more so looking at times you can hit that per week. I think it's supposed to be like hit a body part a minimum of twice per week.
To maximize.
Right.
Yeah.
Which is a great example because I know a lot of people who do structure their own programs in like when they're focusing on muscle groups or body parts, they do like, let's say they do quad or they do, I don't even know. I can't even give you this example because it's been so long since I've trained this way, but like quads and calves on Monday, back and bis on Tuesday, hamstrings and glutes on Wednesday, and they only hit those body parts once per week. And that sometimes can, or oftentimes will hold you back versus doubling them up and hitting them at least twice per week. Right. So talk about physique, Josh, since we're kind of breaking down.
Physique and physique plus 5 and 6 days. Those are your more traditional bodybuilding splits. I still don't do the bro bodybuilding split. Like it's still push, pull, upper, lower. I'm sorry, push, pull, legs, upper, lower for the 5 day, push, pull, legs for the 6. And we are in that 6 to 8 exercise range, 3 sets per part. So we're trying to optimize efficiency along with maximizing volume for focusing on, progression with hypertrophy. So that, and then we've got hybrid, which is the other program I perform, Evolve Hybrid, which is, like the name implies, it's a bit more of a hybrid approach. We want to be more efficient, a bit lower on the exercise scale. It's just an upper-lower split, and it's really designed to get you in and out in depending on how much rest you take. You could be done in 20 minutes. You could be done in 35-ish minutes. So different levels we take it to with that regard. But just before we go into the breakdown on days per week, I just want to hit on when it comes to that range, like you guys are going to hear all the time, 10 to 20 sets. There are some people, a la Dr. Mike Gisertel, who is a very smart person, obviously, who will go to extremes in that high amount of volume. Like in their app, I was playing with it for a little while. They had me doing 37 sets of shoulders per week. And it was
just the RP app?
The RP app, yeah. And to me, that's just completely
37?
37
of shoulders out of all things.
One workout would have like 7 sets of lateral raises. So there are people who still go to that extreme. It's like push the volume as long as you're still recovering. Push it, because that's how you're going to optimize it. I don't necessarily agree with that. I've scaled down to about 12 sets per body part per week. And again, in that 4-day split, I am seeing my best progress that I have in a very long time. So bringing that all the way back, that 10 to 20 set range, they will tell you the more advanced you are, the longer you've been training, the higher amount of sets you should be in. Even that is no longer necessarily the case. As long as you're pushing intensity to the right level for each set, you can bring that amount way down and see great progress.
I want to touch on something quick because yes, there are, potential quote, I don't even know if I want to call them rules, but like guidelines, recommendations, we'll call it recommendations as to how many sets might be most optimal. And to Josh's point here, like what's optimal for one person might not be optimal for someone else. But I think it's important to mention this. When we actually look at like strength or hypertrophy research, and we could probably call Brad in, honestly, to have like a real in-depth topic about like current research on muscle hypertrophy and strength and muscular adaptations. What I do know and can speak to is that the range of what can elicit the adaptation that you're looking for is very broad. And so when we look at hypertrophy research, it might be, anywhere from 6 reps to 30 reps. You can see hypertrophy in. Like it is so broad. And the other piece of that is that as long as we are getting close to failure, which we would consider 1 to 2 reps shy of true muscular failure. And if you've never taken a set to failure, you can't tell me you know what 1 to 2 reps in reserve looks like unless you've never taken this is just generic advice for everyone. Get on a something that you can't hurt yourself failing, a leg extension. Get on a leg extension and take a set. I don't care what the weight is. It could be 10 pounds or it could be 100 pounds. Take a set to true failure, not where your mind is like.
It burns. That doesn't mean it just burns.
That's not it burns. That is
your legs won't work anymore.
I literally cannot extend my knee any more than at this point. That is true failure. And I don't mean like your mind is failing. Your legs physically, your quadricep muscles physically cannot push that extra rep. You fail that rep. That is true muscular failure. So if you ever see in your program, whether it's with a coach or in the app or whatever, like 1 to 2 reps in reserve, 1 rep shy of that is still nearly a set to failure. And I really want to like harp on that for a minute because I think most people are actually not exercising or strength training anywhere near their actual level of failure, or mechanical failure, or momentary muscular fatigue is also what we would call that. And so I want to harp on the fact that as we talk about, sets or strategies or splits or anything like that, the way that you can gain strength or gain muscle is still very, very broad. You can gain muscle training in a, 6 to 8 rep range. You can gain muscle working in a 20 to 30 rep range. As long as we're getting that set as close to failure as possible, if not at failure. Sub maximal we're thinking like 1 to 3 reps shy of failure, which again is very, very, very intense. And then I forgot what my other piece of was of that. Training very, very close to failure. Rep range is very broad. I had one other point to make, but now I can't remember it. But if you've never trained to actual failure, you need to know what that feels like in order to know what 1 to 2 reps shy is.
It's a lot harder than you think.
It's a lot harder than you think. And the range is very, very broad. So as long as you're getting what we do see in current like muscle hypertrophy research is as long as you are training at near failure capacities, regardless of the rep range or the amount of sets you're doing, you should see progress.
I dig it. All right, let's jump into, and we'll do like a rapid fire. So I'm going to give you, I'll go back and forth. We'll start with Alessandra, then Joelle, then Alessandra, Joelle. I'm going to give you days, and you give me 1 or 2, maybe 3 if you've got them, ideal splits for that breakdown. Alessandra, 1 day per week.
Full body. The only way.
The only way.
Yeah, definitely.
Joelle, 2.
2 full body. Preferably non-consecutive days.
Would you ever recommend an upper lower?
Yeah, I would say if they have to be consecutive days. If they're non-consecutive days, I'd prefer full body. But if we can't get 2 full body days in a row because it's not enough time between resting, like recovering body parts, then I would probably split it into upper lower.
3 days.
I personally would do 3 full body or upper lower full.
4?
Yeah, I would be 3 full body as long as non-consecutive. If consecutive, or if 2, I know, yeah, if at least some of those days are consecutive, then I would split it, probably push, pull, full.
Joelle, the rule breaker.
Why am I
You're
the
4
rule
day.
breaker?
I'm going back
4
and
day.
forth. You got a 4 day now.
Oh, sorry. 4 day. Upper lower, typically. I don't typically we're not gonna have a full body with a 4 day because you're gonna have some consecutive days. You could do something like a push pull legs full. I've seen people do that before, but I just like to typically with a 4 day I'm doing 2 upper, 2 lower.
All right, now we do have some proponents, some big fans of the total body every day, and I mean this whether it's 2, 3, 4, 5, 6 days a week. What is your thought on integrating that after this adaptation period? So there is a period where your body has to adapt to that just to get used to the recovery. It's less volume, but you're doing total body every day. Are you totally against that? Do you ever see a place for it? Are you open to experimentation? This is a Jeff Nipper thing for a while.
I think it depends on the nature of your goals as well as recoverability, as well as if it's a training modality that you really enjoy.
Got it. 5 day.
Upper, lower, full. That's build, and that's why I do that for build because that's my preference. Or you could do push, pull. Wait, 5.
Lower, upper, lower. Push, pull, lower, upper, lower.
Yeah, I guess that works. You stole my answer, but
Well, I
whatever.
was filling in the blanks. You were slowing it down here. Wes is
Okay,
looking for
sorry.
the nipple.
Yeah, he probably is.
Joelle, 6 day.
I don't love a 6 day for most people, but I would probably go lower body, upper body.
Who starts with lower?
So I would probably break down, here's what I'm thinking, breaking down lower, upper, and push pull. So like lower body, day 1, upper body push, upper body pull, lower body day again, upper body push, upper body pull, rest.
Yeah.
Ugh, that sounds awful.
Push, pull, lower.
Yeah.
Push, pull, lower.
Yeah.
Day
Yeah,
off. Push, pull, lower.
that would be a more concise way to put it.
For those who weren't following the train of thought, push, pull, lower, day off in between your 3 on, 1 off. 7 day.
Not NA, not applicable.
That was a trick question. Well
Yeah,
played.
I won.
Would
Did I
not.
win?
Well played. All right, guys, let's break down to conclude this episode special training techniques and their benefits. So where my mind was going with this, I'll kick it off with my first 3, and then we can jump in. I know Joelle has a special section prepared for us. But things like drop sets, rest pause sets, cheat reps, and just to explain what each of these are. Drop sets are doing a set to, if it's that 8 or 9 RPE, it's that 1 to 2 reps short of failure, reducing the weight by about 25%, and then continuing to absolute failure just by reducing the weight. Same movement. No rest in between, immediately dropping weight and then going to failure. Rest pause sets is where you take a set to, again, 1 to 2 reps short of failure, wait about 15 seconds, and then go again to failure. So you're resting for a very brief period and then continuing again to failure. And then that third one being cheat reps, which have gotten a bad rap for a while. There isn't a place for these in every exercise, but for something, like a curl, you could add in some additional reps, cheat reps, just forcing a little bit extra activation. All three of those are going to fall into the benefit of what we call forced volume, which there has been some pushback on in regards to actual effectiveness and beneficial, effects towards overall results of the program. Typically, they're not going to hurt. It's you'll get a little better pump, and it's going to go a little bit further on the fatigue spectrum. So that would be the detriment as far as how much extra benefit you're getting from that. But this is something that's been tried and true for a lot of people for a long time, going back to old school bodybuilding. So those are 3 areas, 3 categories of some additional training techniques you could utilize within the actual program, especially if you're limited as far as overall equipment. So if you're working out at home, you've just got a set of dumbbells, you're looking for a new stimulus without actually needing more weight or needing more equipment. Those are a few techniques you could utilize. Anything else you guys would put that would be related to those 3, any additional benefits or detriments you would see from using those 3 before we pass the mic to Joel's?
I would just add John introduces a lot of his clients to something called myo reps, which is basically a rest pause training technique, which you just talked about, but you're taking a working set to an approximate amount of muscle failure, or pretty dang close to it, to activate and stimulate really as many muscle fibers and motor units as possible. And then the goal is to maintain that activation over the next period of time by breaking up the rest of the intended volume with really short rest periods, and multiple short sets to failure. So it's just another kind of rest pause technique. I really like rest pause. I like drop sets. I like rest pause. I love having that like sustained burn for as long as you can. But there's a benefit to having like heavy sets to failure, lighter sets to failure, myo reps. Like you do want to have a variety of different rep schemes in your training. So it's not something I would necessarily use for every single set of every exercise. And you're not going to use myo reps on something like a barbell back squat. But on something like a leg extension or something more isolated, a bicep curl.
More ISO.
Yeah, it's better for like more isolation work.
Slightly different, and even I'll throw these 2 in as separate things, but tempo work versus like eccentric.
That's my jam.
Eccentric or tempo?
Well, just both. Tempo. I program both of those often in build and move.
Okay.
Where you
slower, like in general, a slower down than up tempo.
A slower negative.
So tempo, there's many ways you can implement it, but typically, yes, it's slower on the eccentric portion than the concentric portion. And that's just more time under tension. It makes it a lot harder. I also love pause work. So like a pause squat. So a normal tempo on the down and up. Sometimes it can be slower on the down, but pausing at the end range of motion and then that explosive movement on the way up can be great. And then eccentric. So think slow eccentric. I mean, I guess we kind of touched on this, but like I'll program it often for pull-ups. So if you're struggling to get your first pull-up, doing negative pull-ups or slow eccentric pull-ups. So jumping to the top or using assistance to get to the top of the rep and then slowly lowering all the way down to the bottom is one of my favorite ways to implement that for people who want to get stronger in their pull-ups or want to get additional reps in their pull-ups.
And just to be clear for concentric and eccentric is going to be the shortening of the muscle. And then the eccentric component is going to be the lengthening of the muscle. So I don't love to say like the up part or the down part, because if you're on a squat versus like a bench press, those are different concentric and eccentric loading.
All right. Next section is a little closer, near and dear to Joelle's heart. Blood flow restriction training.
Yeah, so it could be a cool technique for people to play around with. It can be a little bit more technical. You might need to get some additional like gear to make it work. And by gear, I mean like literally going on Amazon and buying some like quick release like tourniquets
Trend.
you could use, which sounds which sounds intense. And it is kind of intense. But for those that don't know, a lot of my
Kind of
master's
intense. It's brutal.
work. It's painful. It does hurt. But my master's thesis work when I was doing my graduate degree in ex-phys was blood flow restriction. If we want to get real specific, my like thesis study was that we had to run. So like long story short, in order to like finish our graduate work, you had to kind of similar to doing a PhD, but way not as intense. And you're not really writing what they have to write up for a PhD. But we had to conduct our own study. And so I was very, very interested in blood flow restriction at the time. It was starting to get real popular with like Lane Norton.
I was going to say, is this the Lane Norton era that
this was like the
intrigued you?
Yeah, like 2014, 2015 era of like Lane started to talk more about blood flow restriction. I started diving into that research with Jeremy Ledecky. I got to interview him and I have that somewhere. But anyway, I was fascinated by blood flow restriction and I was all about like the cheat codes to hypertrophy at the time. And I ended up conducting a study with some of my other graduate peers on blood flow restriction in conjunction with post-activation potentiation on sprint performance. Josh, you may have heard of post-activation potentiation. Have you ever seen that before, Pap?
Only from the blog that I republished. That we wrote.
Okay, great. I feel like sometimes like baseball players or like other people who have been in like more organized sport have sometimes heard of PAP, but it would be something like doing, when you see a sprinter get ready for their race and you see them doing these like jumps, just like jumping in place to like prep their neuromuscular system, prep their quads for like the sprint they're about to do, let's say.
So like long toss before pitching.
Yeah, like that's essentially PAP in some capacity. So anyway, long story short, I know a bit about blood flow restriction and PAP, but specifically when we talk about blood flow restriction, typically this is looked at as now it's looked at as more of a hypertrophy technique, but essentially what you're doing is applying external pressure. So typically we would see this done with like a cuff or a band of some sort. You put it around a limb during strength training. And the goal is to make it tight enough that you're actually restricting venous return, which is blood leaving the muscle, and only partially limiting arterial inflow. So you basically want blood to come into the muscle as you're working it, but then not really let blood leave the muscle. And so you're creating like a blood pooling effect in a muscle to create this sort of hypoxic or low oxygen environment in the muscle. And that, in theory, can help to stimulate different anabolic responses for the muscle. The benefit and the biggest component here is that you're able to stimulate an anabolic response at a much lower load. So you can see that if you're working at a much lower load, but you're getting the same anabolic response that you would get if you were working at a higher load, you can argue like it's easier on the joints. It could be great in a rehab setting. If you're not recovering well or like you're feeling achiness within a joint, getting to still work that muscle at a lower load could be really helpful. So essentially it's making the muscle work a lot harder than it would if it didn't have the restriction cuff or band or wrap on it. And the muscle does, like what we do see is the muscle does get stronger and bigger in a statistically significant way when it's implemented correctly. Typically we see more growth than strength per se. So like the hypertrophy doesn't quite match the strength gains. And to be very, very clear, I'm not saying this is like a miracle technique. We would see very similar hypertrophy gains with low loads as we would see with higher loads and no BFR. So you could argue like, oh, I could do a bicep curl at a high load and see the same progress essentially that I would with BFR, but you're getting to do it at a lower load. Does that make sense?
Mm-hmm.
Yeah. So to clarify a little bit further, high and low, like you're going to be using less because you're restricted and it's going to be more difficult.
Yes.
Every time that I've done them, it's been usually 4 sets, 15 to 25 reps. Does the rep range matter, or could theoretically you're using a lighter load, but could you do 6, 8 reps?
So common protocol is 4 sets, typically structured at 30 reps on the first set, followed by 3 sets of 15 reps. So you are typically using a low load for high reps, again, because you need to have enough time under tension where blood really is pooling in the muscle. And because you are at that lower load, you do need more reps. So again, typical protocol is like 4 sets. First set is 30 reps, then another 3 sets of 15, but you are only using 20 to 30% of your max.
I remember I would do bicep curls, BFR bicep curls, and I would literally use 5-pound weights when I could.
Yeah.
At that time, I was curling like probably 30 pounds in each hand. And the pump that you get, first of all, is insane. And I just remember it's so painful. Like to finish that last set of 15 is like, you're suffering.
You want to cry. Yeah. You absolutely want to cry. And so you're also keeping the rest periods really short, like 30 to 60 seconds max, to help really maintain that pooling and that metabolic stress in the muscle, because that's what's helping to drive some of that anabolic response. I would say something to keep in mind that might be like a limiting factor in some capacity is you're kind of limited in what you can actually put the wraps on for that are going to have a positive effect. Typically we want to put it on the proximal part of the limb. So like the upper leg or the lower leg. That's really like the only place you're putting it, like right under your armpit at the top of your leg, like as high as you could get it on your arm so that it's still like above your bicep. And then you would do the same thing like at the very, very top of your leg to like help pool the blood in the quad. So you're really only like, you're kind of limited to like quads and biceps pretty much. So exercise selection, is something to consider there. But it first actually gained popularity in like a physical therapy setting because you were allowing people to rehab a joint or a muscle or like be able to do knee extension or leg extension at a really low load that would be great for a rehab setting, but really still allow the muscle to gain strength and hypertrophy back. And then of course, like the bodybuilders pick it up and they're like, how can we tap into this and get more jacked and more shredded? So ultimately it's a way that someone can get the benefits of lifting heavier weights without having to actually lift heavier weights.
Talking about this,
the $5 tourniquets on Amazon for like upper body, and then like actual leg wraps we'd use for lower body. But my arms would turn purple.
Knee wraps. I have knee wraps.
Yeah. Yep. I had like quick release. They were like these little red, like quick release tourniquets that you could just like tighten and snap on.
This might be something interestingly to sprinkle in postpartum. Because as you're getting back into lifting, like you're not lifting super heavy loads, but this could be a way to maintain your biceps and quads on top of doing the other things.
It can even be used maybe in like a deload setting, like a deload week, active recovery week, where you're wanting that reduced kind of training intensity to maintain hypertrophy, but without the fatigue or the joint stress. That could be very helpful. But yeah, I would say just in terms of like proper implementation, without getting too much into the weeds, the trickiest part probably is finding the right amount of applied pressure. Like that is the hard part. You guys know probably from doing it, like if you make it too tight, you're like, oh, that's actually like too tight. My hand is numb. Like that's no good. We don't want to restrict so much blood flow that we're actually not even getting the arterial blood flow. So, and this is again, kind of similar to like hypertrophy rep ranges. It's so broad. Like the recommended pressure usage is like 50 to 80% of arterial occlusion pressure. And in research, they do this by like actually measuring arterial like blood flow, or arterial occlusion. You're not obviously doing that in a gym setting. You're not holding, like sonograms and like muscle devices up to your, muscle. So a lot of it is really going to be like trial and error with the right amount of pressure applied. But it is uncomfortable. It is painful. It is painful. Yeah. You do like think about when you have that muscle burning feeling, it is that times like 100.
It's not even just it's almost like a crampy burn.
Yeah.
It feels
you're
like your
actually saying
bicep
ow.
is
You're
going
saying
to
ow
like
between sets,
It is
like
on fire.
burst. It feels like it's going to explode. Like that's the
which
type
is a
of pump
wonderful
you get.
feeling, but at the same time, it's agonizing.
Yeah. So anyway, yeah, maybe we'll sprinkle that into some of the muscle mommy or postpartum or something. You might have to get some quick release tourniquets or something on Amazon, but it's fun to try. It's fun to play
It
around
is
with.
fun.
Yeah.
That is BFR in a nutshell. The last one I think I'd throw into this category would be like supersets, maybe trisets. I wouldn't throw circuits into this, but as far as specialized exercise technique, utilizing something for a time saver. So yes, you can get into something where you're training the same muscle in a superset. A lot of times you're using opposites, so chest, back, bis, tris, and this is limiting fatigue in the muscle you just did while maximizing the amount of time efficiency. So would you guys say there's any specific benefit outside of efficiency of the workout and time to utilizing a superset? Or detriment?
Detriment.
I
It
could see there being
depends
a detriment
what the
if-
exercise selection is.
Yeah. I don't like to pair a superset. Like if I know for time saving purposes we want a superset, I'm picking two exercises that are not necessarily, one is not fatiguing the other. So where I see it being a detriment is if you superset squats with leg extensions, one of those is going to suffer because you're already pre-fatigued from the first exercise, which like if the goal is to just like completely burnout set, fatigue, like you will have that effect. But if the goal is like maximizing strength and so you want to be very well rested for your next exercise, you're not going to have that same effect. So again, it kind of depends on what the goal is and like how you're programming it. If you're programming like antagonist, like opposite body parts versus are you working the same body parts and now one is pre-fatigued, there's sometimes a case for that pre-fatigue and burnout. But other times you might want to allow that muscle ample rest so that you could go into the next set with the rest and recovery that you might want.
So occasionally I'll do something like incline bench and then a cable fly, and I'll superset those specifically for, getting a little more pump. I do it personally for the time efficiency. I don't actually program it like that in the program, but I will do it as a superset because I don't mind. It's an isolation movement, a little more pump. I'm kind of extending that first set. Totally detrimental, like we're just getting it in so like you can do it, but any benefit to not strength, but specifically hypertrophy?
Yeah, I would say yes. I would say more so hypertrophy benefits than strength benefits.
Agreed.
Because again, like strength, you're really wanting to maximize rest going into that next set. But I program supersets in Muscle Mommy all the time from a hypertrophy standpoint, fatigue standpoint, time under tension, metabolic stress standpoint. So I would say for hypertrophy, as long as you're not entirely fatigued, like I wouldn't recommend supersetting like incline bench press with then another like cable press. Like repeating the same exercise in a superset,
Dumbbell
but just
flat.
a different variation. Yeah, like flat bench press and then incline bench press. Like I wouldn't program a superset that way, but because you're kind of going from compound to a little bit more ISO, I think that's serving the purpose that you want it to when it's time efficient.
Agreed. Any other wild cards to throw into this category?
No, I don't think so.
All right, homies. If you're intrigued, you want to start dabbling.
Wait a minute. We didn't touch on fat loss, did we?
No. Did we skip right through that?
Because
We did.
you put
We
that
let
in the
off with
intro.
that.
You put that
We
in the
let off with
intro,
that.
so we have to include that, Josh. No, but I kind of just wanted to add this in because it's a common question that we get from app users is, do I need to change up my training if I'm entering a deficit or if I'm focusing on fat loss? Do not change your training in any aspect. Like you want to maintain strength. You want to be as strong as possible, have as much muscle mass as possible. There's no benefit to doing higher reps or switching your program or doing a different split. Like it really comes back around to just implementing a training that fits your season of life, that you enjoy and that you can be consistent with. And if you can,
I was going to say, that said, like you can cycle through different rep ranges, but you're not changing that because you want to go from fat loss to muscle gain and vice versa.
That's what,
so
that's
it's
what I'm
okay.
saying.
Like I'm doing 8 reps. I want to go do 15 this month because I'm craving the burn. Like, you can still do that, but your goal, it didn't change because of your goal.
Yes. So
Yeah.
do not change your training just because you're entering a different season of life with nutrition. I mean, my goal when I am in a fat loss phase is to maintain and like push training just as hard, if not harder, and maintain that strength as much as I can so that we don't see a loss in strength or muscle mass or hypertrophy at all, because that's the last thing that you want when you're decreasing body fat. You're already in a stress state. You're already at risk of losing muscle if nutrition isn't optimal. Like, eat your protein, lift the weights, and you will have great results with your fat loss phase in changing what your body looks like.
I'm going to do it anyway. Great success.
I need to stop saying that, but like, that's just my go. Like, every time I say that.
It's your go-to. It's Borat's go-to.
I don't know why.
Josh's go-to.
So yeah, it's my go-to.
Yeah, I would just add on to that, kind of along those lines. You know, if you're thinking, oh, should I do muscle mommy or build or physique or whatever? If my goal is fat loss, you do whichever one you like the most, because none of them are going to affect your fat loss abilities any differently. A, we need a deficit for fat loss. B, we can't spot reduce fat. So if you see in Alessandra's program, there's a lot of tricep work and you're like, well, I hate the fat on the back of my arm, that is not going to get rid of it, just to like put that out there. And so anyone who is telling you that they have fat burning workouts for you or to buy their program because you'll just incinerate fat off your body,
they be lying.
Yep, they be lying.
The more you know.
The more you know.
All right, my nipples are about to start leaking, so
Wes is gonna be mad.
Where can they find you?
I'm at Alessandra Skutnik.
Before we totally sign off, you get to sign off now. She's at Alessandra Skutnik. She's gonna go feed my baby. A few things. If you guys were intrigued, you don't want to do this all on your own, we've got the app, so that's your easy step. That will be linked within this episode. Joelle, can you still hear me? Because everything went quiet.
I hear you.
Okay,
I'm here.
Cool. That was weird. I got the app. That'll be linked here. Those are, what are we up to now? 8, 9 different programs. You have access to all of them. You're not limited to that one specific program. So jump in there, see what you like, read the descriptions, try a few, pick one that you want to roll with. For those who are ready for our premier offer, that is the one-on-one coaching. Everything is built for you, built with you. Your coach is your expert in your corner. We have the best credentials in the industry, bar none. If you don't believe me, go check out our team page and see what those all look like. Jump into those bios. Our team is full of rock stars. So if you're stuck, A, that's going to shortcut the amount of time you spend trialing and erroring. And B, you've got someone in your corner who's actually analyzing your specific data. So if you're not sure exactly what is going to work best, like, we will put the data down in your private portal, show you what's happening, manipulate those protocols to really maximize overall efficiency and get you to your goals. We've also got our free resources tab. This podcast is a free resource. We've got our blogs, but we also actually put out things like macro calculators if you want just a generic something to get started. Those are all listed in there as well. Also, little housekeeping, 3-episode rule on this podcast. If this helped you in any way, you're listening beyond those 3 episodes, we just ask that you share it. Leave us a quick 5-star review. That helps us grow the audience. As we've alluded to in the past, we are not the fitness league. That's the title of this podcast, but you are the fitness league. This is built out for you. Inside joke there, I guess, with our good buddy, because I didn't say you guys.
Yep, you said you. Good job.
I did say you. He said it sounded good. I wanted to roll with what sounds good. So you are the fitness league. You're the man. You're the fitness league. Everything we do is to make the world a happier, healthier place, and to grow that audience. That's kind of your role in this is share it. If you're not getting value, just log off and never look at us again. Totally understand. It's fine. But if you are getting value, someone else can probably get value as well. So that's the whole point of the share. These are free resources for you guys to utilize. Pass that along to somebody else. We love you. We appreciate you. Where can they find you?
You can find me at Joelle Samantha, but I wanted to add 2 quick things. One, you mentioned the blog, and we have a blog on almost everything that we talk about on the podcast. Like, I know John's got a podcast up about myo reps. You mentioned you had heard of post-activation potentiation because you remember uploading it onto the blog from an article I wrote. So with that, we have a search feature on our blog. So if there is something specific that you're looking for about dieting or a training modality, chances are we have something up there for that. So A, just keep that in mind. And B, I'm just going to call some of you out, because based on the amount of reviews we have on this podcast and the amount of people I know listen to this podcast, y'all aren't following the 3-episode rule. So I'm just gently, politely calling you out. Leave a review if you like it, if you like it, it helps you, you enjoy it, share it, leave a review. We love you. And
laying down the
fitness
law.
league.
You are the fitness league. So here's one little hack that we've talked about this in the past. If you can't even take the action of just clicking 5-star, if you haven't yet, like takes 10 seconds, pause it in the middle of the episode, pause at the end of the episode, hit that 5-star. How much are you actually applying from the lessons that we're teaching? So that's your first ask. That's your first action step. Give us a 5-star. We love you for it. We greatly, greatly, greatly appreciate it. And make sure you're applying this stuff. Don't be an information seeker. Be an applier. Make sure you're actually doing these things, whatever aligns with your life and where you're at right now, to see those benefits. So again, thank you for being here. You can find me at Josh Skunnick, and everything else is linked